everybody, it's Dr. Lisa. And as you know, it's Health Literacy Month. So we've been talking to different specialists this month. And today I'm so happy we are fortunate to have Dr. Joe Melancon with us. Am I getting your name correct, doctor?
Yes, you pronounce my last name.
Why don't you go ahead and introduce yourself to folks, let them know who you are and what you do.
So I'm Joseph Keith Melancon. I'm a transplant surgeon, and I'm the director of the Ron and Joy Paul Kidney Center here at George Washington Hospital. I'm also the director of the Transplant Institute here at George Washington Hospital.
Now, kidneys are something no one thinks about until something has gone wrong. It's another one of those things in our bodies. They operate and we don't, they don't bother us, so we don't bother them, right? So right. I think it's really important to start this conversation just helping people understand the importance of the kidneys. What do they do and how do you take care of them?
Okay, so we are born with two kidneys, and basically every couple of minutes, all of the blood in our body passes through our kidneys. They are a filter, but they're much more than just a filter, filtering out all of the waste that's in our blood. They also create hormones that are very important. They make blood. In other words, the hormones that come from the kidneys goes to other parts of the body to make all of the blood cells that you will require. So if your kidneys are not functioning well, you don't get rid of the waste, which means that you will die pretty quickly if your kidneys are not functioning. And you also become what's called anemic. You don't have enough blood in your body if your kidneys are not functioning well. And some other way or some other means of getting those hormones must be done by doctors in order for you to have enough blood in your body.
How does someone know if there's a problem with their kidneys?
So usually, unfortunately, I've had many patients that since they don't go to the doctor regularly, they didn't know they had kidney problems. If you go to the doctor regularly, the first sign of kidney disease is going to be that some of your normal blood work is going to be off kilter. And that's how the doctor is going to diagnose you. But if you're not going to the doctor regularly, or if you're between visits and you have kidney problems, usually the first thing that people realize that makes them know they have kidney problems is they get swelling. They will get swelling in their ankles or in their legs, or if it's even worse than that, they will start to have trouble breathing.
And why is that happening, Doc?
And basically what's happening is you're not filtering out the fluid that you're taking in. So you are now at the end of what's called chronic kidney disease. There are 5 stages to kidney disease, and you can go through 4 of those stages and maybe not even know you have problems. Once you get to stage 5 is when you start to get these swelling. So when you're not getting rid of the fluid that you're taking in, it causes you to swell.
So are you saying the best way to identify kidney disease is to go to the doctor and get a blood test, or is there some other way to recognize the signs of kidney disease?
Yes, absolutely. The best way is to check in with your doctor regularly. A blood test will diagnose you with kidney disease. However, it's usually a late sign when your blood test starts to go awry. In other words, the earliest way to diagnose kidney problems is actually a urine test. If the doctor ever tells you you have a lot of protein in your urine, that is abnormal. That's an early sign of kidney disease. So when we screen people for kidney disease in the community, we're looking for protein in the urine before their blood tests turn abnormal.
And how do you do that test in the community? Because there are a lot of people who actually don't have a doctor, but they want to find this out. Is there a test they can do?
Yeah, so it's called a urine dip test, and you can actually buy the strips in any drugstore and just put a strip in your urine, and it will tell you if you have too much protein. But that's what we do. We go out into the community, and usually we will take their blood pressure, and then we will do this urine dip test. One of the #1 reasons to have kidney disease is high blood pressure. So we screen people for high blood pressure. The other disease that usually leads to kidney disease is diabetes. So those are the two things I believe every patient needs to be screened for: diabetes, high blood pressure, and then kidney disease is the third.
So if you can't feel kidney disease, can you help people understand the connection between high blood pressure and diabetes and kidney disease? How is it that you could have these health conditions and then the next thing you know, your kidneys are affected? What's going on there?
Yeah, that's a great question because, they call high blood pressure a silent killer because that's exactly what it is. Over time, if your blood pressure is high, what's happening is that pressure is pushing constantly on the cells of your body, the cells that line all of your vessels. So that's why high blood pressure is a vessel problem. So where are vessels? Vessels are going to be going to everything in your body, but the sorts of things that are problematic when your vessels are getting injured would be the vessels going to your head. That's why you can get
Like arteries and veins, is that
right? Yeah, like the
your
arteries
vessel?
that are going to your head, the arteries that are going to your heart, and the arteries that are going to your kidneys. So that's why vascular disease leads to kidney disease. Same thing with diabetes. It's the other side of the problem because the pressure is one thing, but the diabetes causes the vessels in your body to stiffen. And the high sugar, when sugar is very, very high in concentration, it's toxic. So it causes cells to die. And that combination of stiff vessels and high pressure and cells dying, all these things lead to kidney disease as well as other vascular and organ disease.
Yeah. We have a question from the community about why there seem to be so many dialysis centers in Black communities. Can you talk about that?
Yeah, I often joke about this, although it's kind of sad, but it is true. Black people have more kidney disease. So we have 4 times the kidney disease as the general public, particularly white people. So if white is the norm, Hispanic people have a little bit more kidney disease than white people. Asians have more still, and Native Americans have more. But they're all about maybe twice the rate of kidney disease than white people. We have 4 times the rate. So if you see an area of any city where there are more Hispanic and African American people, there's going to be more kidney disease. So we make up only 12% of the population, but we make up 36% of the population that needs kidney transplants. So obviously we have a lot more kidney disease. The question that always follows that is why? Well, one of the main reasons is that we have more obesity, more hypertension, high blood pressure, and more diabetes than other groups. There probably are some genetic or epigenetic phenomena as well, but the main reason is we are not as healthy as we should be.
So what do you think, if you had to just pick one thing people could do to stave off kidney disease, what would you suggest they do?
Well, we as African Americans tend to be very sensitive to salt. So the one thing we should do if we want to decrease our risk of kidney disease and therefore high blood pressure is decrease salt and sugar because of diabetes in our diet. How can we do that? By decreasing the amount of preservatives that we ingest. How do you do that? Well, cook at home. I am from Louisiana. I love spicy food, but spice doesn't mean salt, right? We think of spicy and we think of salt too often. You can use any other spice other than salt or other types of salts, and that is much, much healthier than putting salt in your food. So if there's one thing you could change, decrease the amount of preservatives you eat, cook at home, and cook with a lot of pepper, a lot of seasoning, but no salt.
Yeah. And I'm glad you mentioned preservatives. During the pandemic, we've had a lot of people asking, well, what's in the vaccine? I don't want to get the vaccine because I don't know what I'm putting in my body. But if you think about a lot of the foods we pull off the shelves, they have a lot of foods we don't recognize as well, and the preservatives. So what's your favorite way to season food without using a lot of salt?
Pepper. I love red pepper, black pepper, Garlic is my favorite thing in the whole world. I just love fresh garlic, but even garlic powder. So like I said, you can pick your favorite spice. Just go to a spice rack and you can just knock yourself out, because spices are very healthy. They, like things like turmeric can decrease inflammation. Garlic can help decrease your blood pressure. But really, we as African Americans, we come from a tradition of very savory food. And if you go to West Africa, you find that these West Africans, particularly, outside of the cities, people use lots of spices, but they don't use a lot of salt. We are very sensitive to salt. This is one of the things that drives up our blood pressure. So if you have high blood pressure, the first thing you should do is to change your diet. The other thing is just move. People think, well, by exercise, you need to do something crazy like run a marathon, but no, just move, just go walking for 30 minutes a day. So the combination of movement, getting rid of preservatives, just cooking at home. I've had so many patients that, they still eat well, they just eat at home and they start to lose lots of weight.
Yeah. We have another question from the community about drinking alcohol. Is it bad for your kidneys? And I'm curious about this because I'm not much of a drinker, but I notice on those evenings I have a drink, it makes me get up in the night to go to the bathroom, which is very annoying for me. But is there anything about drinking and the kidneys?
No, I also have trained to do liver transplant. So, drinking a lot can hurt your liver, but it actually doesn't affect the kidneys. And you're right that drinking alcohol will make you get up in the middle of the night because it is a diuretic. The other thing that drinking a lot of alcohol can be problematic for, which most people don't realize, but I know it happens to me when I drink too much wine. You don't sleep as well. And not getting a good sleep is a problem for your health long term. So drinking alcohol can cause you, particularly if you drink a lot, can cause you to have a lot of problems. But one of them is not kidney problems. Actually, alcohol in moderation is actually better for your vessels. So all the stuff I was talking about earlier with high blood pressure and diabetes and how this is so bad for your vessels, a little bit of alcohol is actually good for the vessels. You might remember some years ago, the French diet, what French people, they smoke a lot of cigarettes, they eat a lot of cheese, they don't die of heart attacks because they drink wine. So wine, particularly in moderation, is actually good for the vessels and good for the kidneys.
Yeah. So at Grapevine Health, we focus on helping people understand health information. We try to make it relatable and talk to people in creative ways so that they connect with the message. Do you think improving people's understanding about kidney disease is enough to prevent kidney disease? And if so, why? If not, why not?
Absolutely. Absolutely. Actually, I have a study going right now where we will get people to fill out a little survey to see what their level of health literacy is. And the people that score better on that survey tend to have their blood pressure under control. They tend not to have kidney disease. So I really agree with you that health literacy also equals better health. The more people know, the more likely they are to take better care of themselves. I'll give you an example. I did a transplant just recently on a very highly educated attorney who, obviously is very intelligent, and for years have been going to her doctor, and her doctor mentioned that she had some protein in her urine. But it was just a mention. It's like there was no follow-up. And it wasn't until she went into kidney failure that when I was talking to her that she realized, wow, this is something that was a problem for years and nobody addressed it. So education about your health is important. And people think just because you're educated, even highly educated, it means that you have high health literacy. That is not true. So I totally agree with you. Health literacy is very important and impacts your health.
Okay. So one last question, and I really want people to understand kidney transplantation, why that's important, why it is worth considering. as an alternative to dialysis. So you've probably transplanted, I don't know, hundreds or thousands of kidneys in people. So just before we go, tell them a little bit about kidney transplantation, why that's important, particularly for the Black community, and anything else you want people to know about kidney transplantation.
Well, thank you. And yeah, I've transplanted hundreds of kidneys. I'm probably getting close to 1,000 in my career. And it is so important for people that have kidney failure. Hopefully we can prevent it. But if you do have kidney failure, dialysis is great because it keeps you alive, but you don't have the same life expectancy usually with dialysis that you would have with kidney transplantation. Once you get a transplant, even though your kidneys have stopped working, you can have a normal life expectancy. So anyone that is getting toward needing dialysis or if they're on dialysis, the best thing for them will be to get a transplant. And the best type of donor is usually going to be a family member. I tell my students all the time, hopefully you've been nice to your brother and sister, because those are the people that you're going to match up the best if you need a kidney transplant. So yes, dialysis is great. And there are many places in the world where you cannot get dialysis on demand. Here in this country, you can. That's beautiful. It will keep you alive. But the best way to stay alive for a long time is to get a kidney transplant.
Yeah, wow. Well, we'll have to talk more about that on our next conversation. But for now, thank you so much for being with us. Really appreciate your time.
Thank you for having me. This was great.